Our presentation today compares and contrasts the benefits of aerobic exercise versus resistance exercise for controlling blood glucose levels in patients with type 2 diabetes, as well as the recommended intensity levels of exercise to produce optimal results. Type 2 diabetes involves insulin resistance. The picture displayed outlines insulin's importance for glucose uptake into cells for energy. Normal functioning insulin receptors accept insulin circulating in the blood, which allows glucose to enter cells via GLUT4 transporters. Although some cells in our bodies can accept glucose without GLUT4 transporters, the vast majority of cells require this mechanism. This process is impaired in individuals with type 2 diabetes, leading to abnormally high blood glucose levels measured in HbA1c. There is evidence to show that exercise is able to enhance insulin sensitivity to lower HbA1c in patients. We will discuss the effects of different forms of exercise to assist PTs and other healthcare professionals with exercise prescriptions. Aerobic exercise has shown to increase mitochondrial density, insulin sensitivity, oxidative enzymes, compliance and reactivity of blood vessels, lung function, immune function, and cardiac output. Glucose uptake has shown to remain elevated 24 to 48 hours following aerobic exercise. This is according to Kohlberg et al. 2016. Apart from glucose uptake, aerobic exercise improves cardiorespiratory fitness and can decrease BMI, which can enhance an individual's ability to remain active, to improve their outcomes, and their ability to control or reverse their disease. A systematic review on 12 trials of acute effects of aerobic exercise on adults with type 2 diabetes showed a 0.46% decline in HbA1c. This is according to Yang et al. 2013. Individuals with type 2 diabetes are at a higher risk for losing muscle strength. Resistance exercise can improve muscle strength and slow muscle mass loss with age. It has been shown that resistance exercise can improve strength by 50% in adults with type 2 diabetes. This is according to Kohlberg et al. 2016. Maintaining muscle strength improves a patient's ability to stay active, which is related to their ability to control the disease and prevent the development of other conditions or complications. By increasing muscle mass, a decrease in blood glucose levels occurs. However, the exact mechanism for how this decline in blood glucose is related to increased muscle mass is unknown. This is according to Kohlberg et al. 2010. A systematic review on 12 trials of acute effects of resistance exercise on adults with type 2 diabetes showed a 0.32% decline in HbA1c, according to Yang et al. 2013. This is the same systematic review that was used for our aerobic exercise section. Although aerobic exercise's acute effects on decreasing HbA1c are statistically significantly greater than resistance exercise's effects, these results are not necessarily clinically significant, according to Yang et al. 2013. Consistency and practicality are what are most important when beginning an exercise program for patients. Patients with type 2 diabetes will benefit from either form of exercise for glycemic control, but the most effective approach is a combination of the two. We advise that PTs and other healthcare professionals not approach exercise prescriptions with a bias for one form of exercise over the other, but focus on initiating physical activity in patients that suits their needs and interests so that they are more likely to remain consistent with a regimen long term. It is important to emphasize the need for regular exercise to produce the best results, as benefits like increased oxidative capacity and increased insulin signaling proteins have shown to be reversed through inactivity, according to Kohlberg et al. 2016.
Since aerobic exercise and resistance exercise are beneficial for type 2 diabetes patients, how should we choose exercise intensity for patients with type 2 diabetes? This diagram shows vigorous intensity activity is better than low to moderate intensity activity to attenuate glycosylated hemoglobin. Vigorous aerobic exercise is better to decrease insulin resistance and fasting serum glucose than low to moderate aerobic exercise training. No evidence shows that high-intensity resistance training is better than low to moderate intensity resistance training. To low lower insulin resistance. However, vigorous resistance training can be better attenuate elevated insulin levels than low to moderate intensity activities. How about high intensity intervals effects compared to mild to moderate intensity interval training on glycemic control? Little evidence shows that there is more effectiveness of high intensity interval training than mild or moderate intensity interval training on glycemic control. Still have any concerns? Is vigorous intensity exercise safe for elderly patients with type 2 diabetes? Yes. The frequency of exercising should be at least 3 days per week for aerobic exercise and 2 days per week for resistance exercise activities. Balanced exercise may be beneficial in special situations. A note for caution: although the literature supports the beneficial of physical activity in the elderly, most of the studies were performed in young old patients, those aged less than 75 years old. The number of old people is increasing sharply, and the results obtained so far may not be applicable to this particular population. Thanks for your attention. Here is our reference.